More than 34 million Americans have diabetes. That's about 1 in every 10 people. And more than 90% of them have type 2 diabetes. Now, type 2 diabetes often develops in people who are over the age of 45, but we are seeing more and more children's, teens, and young adults developing type 2 diabetes. China is the leading country in the world with diabetes. India follows right behind them, and the US is third. But our population is way smaller. And we know that 88% of Americans are metabolically unhealthy, and they don't even know it. Today, I interviewed Dr. Brian Mowll, who has an extraordinary depth of knowledge in how you can reverse diabetes and how you can stop the progression to diabetes with ease. Let's get to the show. Welcome to the Lindsay Elmore Show, a podcast for people who deserve to be healthy, with honest, open, and enlightening conversations with doctors, thought leaders, creatives, and spiritual gurus. You'll walk away with simple and tangible tips and tricks that allow you to live your healthiest life so you can pursue your dreams, overcome obstacles, and leave your mark. Dr. Brian Mowll is the founder and medical director of Sweet Life Diabetes Health Centers and serves clients worldwide as the diabetes coach. He is a certified diabetes care and education specialist, master licensed diabetes educator, and is certified to practice functional medicine by the Institute of Functional Medicine. For over 20 years, Dr. Mowll has been helping people around the world to optimize their health and metabolism, control their blood sugar, and reverse type 2 diabetes using a natural, personalized lifestyle approach. He is the host of the #1 rated Mastering Blood Sugar podcast, the author of The Pro-Fast Diet, Burn Fat and Reverse Type 2 Diabetes in just 6 weeks. Brian Mowll, welcome to the Lindsay Elmore Show.
Thanks, Lindsay. Excited to be here with you.
I am so pumped to talk to you because we genuinely have a totally reversible crisis on our hands with 34 million Americans suffering from diabetes, and over 90% of them have type 2 diabetes. And diabetes is, I think people think of diabetes as just like, okay, my metabolism is off. But no, diabetes is the 7th leading cause of death in the United States. And so it is terrifying that we have 34 million Americans affected by it. So talk to us first about what is the connection between metabolism and diabetes, and maybe even just talk to us about all the different hormones that go into overall metabolic health.
Yeah, I love that question. Metabolic health is a huge umbrella. And you talked about a minute ago, diabetes being the 6th leading cause of death in the US. If you look at the top 10, actually 6 out of 10, 60% of the leading killers, which make up pretty much like 85 to 90% of all deaths in the US, are all related to metabolic health. Heart disease, stroke, Alzheimer's disease, diabetes. These are all connected to metabolic health. We also have to look at things like hypothyroidism, which is related to metabolic disease, can certainly be a driver of metabolic disease. PCOS in women, when women go through menopause, there are hormone fluctuations which significantly impact insulin sensitivity, blood sugar, weight, and metabolic health. Obesity has become a massive problem not only here in the US, but across the world, or at least in the industrialized countries, developed nations of the world. So this is a huge issue. Metabolic health is this big umbrella. And just to help people understand what we're talking about with metabolic health, it's fuel metabolism. It's how we handle incoming fuel substrates like glucose and fat and amino acids and all the micronutrients that we have to take in and process through the gut and route throughout the body. How we actually digest, assimilate, absorb, and utilize all of those nutrients, and then how that drives energy production at the cellular level. So how our cells take in those fuels and how we can then convert them into usable cellular energy, these high phosphate bonds. And that's really that's metabolism, and that's metabolic health, anything that goes along with that. So to me, type 2 diabetes is sort of the pinnacle of metabolic dysfunction. This is where this is sort of the peak of the mountain of everything going wrong. As you said, this metabolic crisis or disaster that we have on our hands. The sort of the end stage of that is type 2 diabetes, heart disease, stroke, Alzheimer's disease, and these other big killers.
It is the peak of the mountain, because once you get there, you have been walking down a pathway towards diabetes for so many years. And it's unfortunate that physicians and clinicians in general don't get more training on helping people to turn around before they ultimately get to the type 2 diabetes. So you mentioned something really fascinating that I find to be complex. And so every time a guest comes on and says, when it comes to our health, we need to digest and utilize and convert and understand the entire physiological process that it takes. In this instance, we're going to be talking about how do we convert calories as well as our vitamins and nutrients into cellular energy. And we've talked a lot, and if you've heard my interview with Sarah Morgan, you've heard us talk a lot about specific calcium metabolism and magnesium metabolism. But walk us through the process and what you think goes awry in the way that we digest food and effectively convert it into cellular energy when we have even small levels of metabolic dysfunction.
Mm-hmm. Yeah, really good question. And this also relates to this idea of calories and what's oftentimes prescribed to patients to lose weight, which is the calories in, calories out model. And of course, physics is real, and the law of thermogenesis is real. Energy can't be wasted or destroyed. So we understand that it is a closed system, but there are variables that most people don't consider when they think about, oh, let me just cut 500 calories once a day, and if I do that for a week, I'm going to lose a pound of weight, and I do that for a number of weeks, I'm going to lose 10 pounds, 15 pounds, 20 pounds of weight. We know from clinical practice that doesn't actually work. That doesn't happen. So there something else is going on there. And part of that answer is what do we get from our food? Right. So if two people eat the exact same things, that doesn't mean they're both going to have the same energy yield at a cellular level. So that depends on our digestive system. So do we have adequate hydrochloric acid in our stomach, for protein? Do we have adequate levels of salivary amylase in our mouth, and then the pancreatic enzymes that are released to digest fats and protein and carbohydrate foods? Do we have adequate strength of those digestive enzymes? Do we have the right microbiome set up to where we're able to extract the nutrients from our food? So a lot of people have maybe heard this, but don't quite understand how the microbiome works and what those trillions of microorganisms in our gut do. And one of their, they're there to protect the gut in some ways. But one of the things they do is they help us to digest our food. They help us to break down certain types of food. They help us to extract minerals and certain vitamins from our food. So we need those. And if there's imbalances in the microbiome of the gut, we may be over or under absorbing certain amounts of energy. So the point of this is that not all of the energy we consume in food form ends up at the cellular level. Once it gets into the bloodstream, there's hormones like insulin and others, which dictate how that gets routed throughout the body. Estrogen, interestingly, is an important hormone in how we store fat, where we store fat. So women, for example, as they go through menopause, their estrogen levels many times will drop, sometimes really plummet. And when that happens, the areas where they store fat will oftentimes shift. So instead of storing fat in the breast tissue, in the legs, in the backside, oftentimes fat will then get stored in the stomach area. And so one of the things we see in menopause, I'm just using this as an example, how these hormones work, is that women oftentimes start to develop a central adiposity. They'll gain weight in their midsection and they'll become more insulin resistant, and that can lead to diabetes. This is just one of the many factors. We have to look at bone health and bone metabolism, cardiovascular health and metabolism. There's foods can be inflammatory or anti-inflammatory. So all these factors play in, and a lot of these things can be influenced. We can be influenced by our diet, our physical activity levels, our sleep. Another big hormone player is cortisol. And cortisol is an adrenal hormone that is released, to a little bit during the day, but during times of stress, we'll get a much larger spike of cortisol. And one of the things that happens is if we're not sleeping well, cortisol levels will rise during the day. And that extra cortisol makes us insulin resistant. Insulin's the hormone that helps us to absorb sugar. So we become resistant to this hormone. And instead of burning fat, we start storing more fat, again, particularly around the organs. So these are just examples of all the different variables that are involved with how we take our food in and what happens to it once it gets into the gut and then absorbed in the bloodstream and then channels throughout the body. It's very important to be able to control what we can control to try to become as metabolically healthy as possible.